Hi, I'm Dr. Robert Ronis. I'm the chairman of the Department of Psychiatry at Case Western Reserve and the Psychiatrist-in-Chief at University Hospitals. Well, I started my career actually in internal medicine, not in psychiatry. It only took an internship year to realize I'd made a big mistake. Called back to my program here in Cleveland, where I had done my medical school, and saw if I could get into the residency in psychiatry here at University Hospitals. And so that's how I started. Went from residency to, I spent 4 years with the National Health Service down in southern Ohio. I was the first psychiatrist in Marietta, Ohio, and the surrounding 4 counties. And I came back to Cleveland in 1990 when Dr. Ishiyama, who was then the executive director at the Mental Health Board, had some discussions with Chuck Schultz, who was the chairman of our department at the time, about starting what they called the PAL program, or Public Academic Liaison program. So PAL was established as an opportunity to train residents, to give an opportunity for residents in psychiatry to learn about community mental health, and at the same time to provide services to the agencies of the Cuyahoga County mental health system. The residents had a full day a week where they were at the mental health center and they saw patients side by side with the faculty, with their supervisors. And at the same time, we provided some educational offerings at the agencies so that the case managers could join with the residents and the treatment team could get education together. Pretty simple model. It's now 32 years that the PAL program has been an integral part, I think, of services the Mental Health Board has offered. Well, the reason I've stayed with psychiatry all this time is that I found it to be very rewarding in terms of the different things that one can do in terms of a career. But for me, part of my career was always about giving back and giving something to the community. I'll confess that was not part of my thinking when I was in medical school necessarily, other than I thought I'd have a clinical practice. But I ended up signing up with the National Health Service after medical school to help pay for the cost of residency. And then afterward, I had to commit to an equal number of years of service, wherever they ended up putting me. And of course, I thought I was going to be, when I was in medical school, I thought I might be a family medicine doctor. But instead, I was a psychiatrist with a brand new baby daughter, most of my family up in Northeast Ohio, and a list from the National Health Service of about 150 places in Ohio that met health personnel shortage categories for psychiatry. When I went and visited Marietta, Ohio, which is the original capital of Ohio, first settlement of the Northeast Territory, it was just a very different experience. A mental health center that had also only had part-time psychiatry, somebody driving down from Columbus. They weren't quite sure that I'd have enough work to do, but they had made the investment and signed up with the National Health Service for somebody. So at the end of the first year, when they came to me and they said, well, it appears that you've seen 2,500 patients since you started. And I said, 2,500 visits, that's a lot. And they said, no, 2,500 patients. It was closer to 5,000 visits. So clearly the need is there. And the need is really everywhere, as you know. But places that are impoverished, places that have fewer resources, that it's more difficult for patients to access care, are the places that I have always found the most appealing. And so that's how I got to be where I ended up. So a lot of people have asked me what I'm looking forward to doing when I retire. And I think the best answer is I'm not actually retiring. I am retiring from my current position. So I will be stepping down after 17 years as chairman at UH and Case Western Reserve, which has been a labor of love, and I am so looking forward to being done. It's been a lot of work, and my first plan is to do very little for about 6 months. I have some patients that I've been following for a long time, and I'll continue to see them, but I hope to mostly take the first 6 months off and then decide what follows. And it'll probably involve some clinical care and maybe some consulting work, but it won't be full-time. You know, it's been a long career with a lot of interesting and wonderful things that I can point to in terms of my accomplishments. But similarly to what I talked about with the mental health centers, there's not a whole lot of single-person successes in any field. And I'm most grateful for the continuous support for 32 years by previously the Mental Health Board, now the Adams Board of the PAL program. Other things I'm grateful for are colleagues that that have followed me into this field or have partnered with me as we've gone through the journey. I've mentioned a few of them, and the risk of mentioning a few is that there are so many that I will miss a lot if I try to mention them all. But as I mentioned, Kathy Burns and I started this program together. Lenora Cola and I co-directed the Center for Evidence-Based Practices. Dr. Kathy Clegg, Dr. Cindy Frabel were some of my first residents in the PAL program, both of whom ended up working within the mental health system. Over the years, about 40% of our graduates have gone into community mental health as a full-time or part-time career, as compared to 2 people in the decade before we started this program, myself and Kathy Burns. So I don't think there's a whole lot of question that we've been successful. Most of the agencies now in our system have medical directors who are graduates of our program. Some have executive directors. And so we have populated the system such as it is. And so I'm very grateful to those people for sharing that vision.